Hello, my name is Keelan.
I'm Amy.
I'm Christina.
We are students at Quinnipiac University currently taking an immunology course, and we are here today to inform you about the MMR vaccine. The MMR vaccine helps to protect against measles, mumps, and rubella, a trio of potentially dangerous illnesses. These illnesses are VPDs, or vaccine-preventable diseases. Thanks to vaccines, these diseases are no longer nearly as prevalent as they used to be.
The MMR vaccine is given in 2 doses. The first dose is administered to children from 12 to 15 months of age. This dose is effective in 80 to 90% of children who receive it. A second dose is given between the ages of 4 and 6, assuring that a strong immunity to measles, mumps, and rubella is created. The vaccine is composed of live viruses that have been attenuated, meaning they have been changed and weakened so that patients will not acquire the actual diseases.
Every child should receive this vaccine with a few exceptions. Those who should not get vaccinated with MMR include individuals with life-threatening allergies to the antibiotic neomycin, to gelatin, or to a previous MMR dose, individuals who are extremely ill, pregnant women, and those who are immunocompromised, which includes patients with HIV, AIDS, or cancer. Those who also do not need to receive the vaccine include people who were born before 1957, as it is assumed that they have already been exposed to the diseases and have developed a natural immunity.
More than 80% of individuals do not experience side effects, but a few may experience some mild effects, including fever, rash, joint symptoms, or redness or swelling around the site of injection. More rare side effects are seen in less than 1 person per every 10,000 individuals who are vaccinated. Since the start of the vaccine, measles, mumps, and rubella have become very rare in the United States. It is still just as important, however, to become vaccinated with the MMR vaccine to prevent these harmful diseases. Let's take a look at why we want to avoid them.
Measles, also known as rubella, is a highly contagious respiratory disease caused by the measles virus. The virus can also be found in the mucus of the nose and throat. It causes symptoms that include fever, runny nose, cough, and a rash covering the body. The rash begins in the mouth or nose and is first noticeable at the hairline. It then spreads to the face and upper neck and will eventually cover the entire body, as you can see here. Fewer cases include symptoms such as ear infection, pneumonia, or even death, and if acquired by a pregnant woman, it can lead to a miscarriage or a premature birth. This disease can be transmitted from person to person through airborne droplets that stay alive for up to 2 hours. If you are exposed to the virus, you may not know you're sick for up to 10 or 12 days after, and the rash may not show up until day 14. The reason this disease is so scary is not only because of the pneumonia that it often results, but also because some people can develop subacute sclerosing panencephalitis, which is a degenerative disease of the nervous system that develops as late as 7 years after contracting measles. So, why is it important to get vaccinated? Before the MMR vaccine was used, nearly all children got measles by the age of 15. Every year in the U.S., there were about 500 deaths and 48,000 hospitalizations from the disease. This number has decreased by more than 99%, and there are now only about 50 deaths per year since the vaccine. This graph shows just how many cases there used to be in the U.S. and how we have nearly eradicated measles in the U.S. today. However, this does not mean that you should not get vaccinated. Measles does still exist in this country and is very prevalent in other countries, especially in India. International travelers are not only at risk themselves of contracting the disease, but they also put unvaccinated individuals at risk if they carry the disease back to America with them. Others at high risk of contracting measles include people who work or live in crowded areas, such as college students or healthcare personnel. There is no treatment for measles other than simply treating the symptoms, so it is imperative to get vaccinated to make sure that you prevent this potentially life-threatening disease.
Mumps is a very contagious disease that is caused by the mumps virus, which primarily affects the salivary glands. Prior to the MMR vaccine, mumps commonly affected infants, children, and teenagers. However, since individuals have been receiving the MMR vaccine, mumps has become a rare disease in the United States. As you can see in this chart from 2010, prior to the vaccine, the annual morbidity per year was 162,344 people. Since the vaccine, there has been a significant decrease in disease prevalence, and there are only about 982 cases per year. These statistics prove that the vaccine is effective against mumps because there has been a 99% decrease in disease. Mumps is spread by droplet and contact transmission. This means it can be spread when an infected person coughs, sneezes, or even talks and droplets of mucus or saliva come out of their mouth, nose, or throat. It can also be spread when people share drinks or food, especially children, because they are unaware of the virus that they may be getting from an infected person. Lastly, it can be spread through contact transmission. For example, if an infected person touches a surface, another person can become infected if they touch that same surface and then touch their nose or mouth. After a person is exposed to the virus, it takes about 12 to 25 days for the symptoms to appear, and about half of those who get mumps have mild to no symptoms. So mumps can be transmitted before a person even knows that they are infected. Although many times symptoms are mild, some of the symptoms include fever, headache, muscle aches, tiredness, loss of appetite, and swollen and tender salivary glands. In this picture, notice the swelling of this child's cheeks and jaw. These are swollen salivary glands, which is a classic sign of mumps. Two important reasons for getting vaccinated against mumps are that currently there is no treatment for this disease, and it can lead to serious complications. These complications include swelling of the brain or tissues covering the brain or spinal cord, also known as meningitis or encephalitis, swelling of the testicles, breasts, and ovaries, and lastly, deafness.
Rubella, also known as German measles, is an acute disease caused by the rubella virus. This disease was first discovered during the 18th century, and its name comes from the Latin word meaning little red. Rubella is found globally, but thanks to vaccinations, it has become less common. This graph shows how the incidence of rubella was rising until about 1969 when the vaccine was licensed. Before vaccination, over 11,000 miscarriages due to rubella infection occurred, thousands of infants were born with birth defects, and many died. As you can see, because of vaccination, the rates have dropped dramatically in the following years. If a child or adolescent is infected with the virus, the disease is usually mild. Rubella is most dangerous if a pregnant woman becomes infected because she can transmit it to her baby. This can cause serious birth defects known as congenital rubella syndrome, also known as CRS. Congenital rubella syndrome occurs when a pregnant woman is infected with rubella, and it results in deafness, cataracts, heart defects, mental retardation, and liver and spleen damage in the fetus. This picture shows a newborn baby with severe cataracts in their eye. The severity of the damage depends on how far along a woman is in her pregnancy. If a pregnant woman becomes infected during her first trimester, then there's about an 85% chance that the infant will be affected as well, which shows how important it is to get vaccinated. The rubella virus is only transmitted between humans, and it's spread through the air by an infected person who coughs or sneezes. Once a person inhales the air particles containing the virus, it is then able to replicate inside the body. After 5 to 7 days of exposure, the virus enters the bloodstream where it can then be transmitted to the fetus. So you may be wondering, how would I know if I was infected with the rubella virus? Well, unfortunately, only about half of the people who have become infected will actually show symptoms. But within the first few days, you may notice mild flu-like symptoms, which begins with a low-grade fever for 2 to 3 days and a rash. The rash shown in this picture is characteristic of rubella infection and usually appears first on the face. It is often the first sign of illness that a parent will notice. Other symptoms of infection include headache, runny nose, red eyes, muscle and joint pain, or swollen glands. If you experience any of these symptoms, or you know that you have possibly been exposed to the rubella virus, it is important that you see your doctor immediately to get tested and treated.
Next, we would like to address some tweets that we have recently received to our Twitter account, QU Vaccine Vixens, from concerned parents regarding the MMR vaccine.
Pat M. from New Hampshire, father of a 12-month-old infant, tweeted at us, "Why must this vaccine be given at such a young age? My child is just a baby and he should not have to get vaccinated right away, since I will only allow him to be around healthy people. #Dads Against Vaccines."
Well, Pat, that's a really good question. A lot of parents have expressed their concerns about this topic. But whether or not you think that you have your child around healthy people all the time, there's never really a way to ensure this. People who are infected with many of these childhood preventable diseases can pass on the disease when they don't even know that they have it, whether that be because the symptoms have not yet appeared or they are an individual who will have the disease without showing symptoms at all. An infant should receive this vaccine at a young age because their immune system is most impressionable, so the vaccine will be most effective. And lastly, infants are vulnerable to diseases, so it is important to protect them by vaccinating early in life.
Our next tweet from first-time mom, Jess P., says, "Isn't it unsafe for my child to be injected with a vaccine against 3 different viruses at once? Won't that make him sick? #ConcernedMoms."
Well, Jess, babies are exposed to millions of germs immediately at birth. All of the vaccines given to infants combined use up only 0.1% of the immune system. That means that just the MMR vaccine alone is almost negligible compared to the amount that a child's immune system can actually handle. Administering 3 vaccines as one at an early age allows for fewer office visits, which means less time and money, and will more importantly mean that your child will be protected for longer. Daniel Z., father of octuplets, said, "A friend of mine told me that the MMR vaccine gave her child autism because there was mercury in the vaccine. Is this true? Why are we giving our children something that will harm them? #Octodad."
Well, Dan, it seems like you have your hands full over there. Reasons why people think the MMR vaccine is linked to autism is because signs of autism don't appear until the age the MMR vaccine is given. There is no scientific evidence that supports that the MMR vaccine causes autism. Many parents do believe that there is poisonous mercury in the MMR vaccine, but this is a common misconception. There is a component of the vaccine that is called thimerosal, which is ethyl mercury. Ethyl mercury is a preservative that is present in vaccines and approved by the Center for Disease Control and Prevention. Methyl mercury is, however, the poisonous mercury, and it is not present in vaccines. Actually, since there was so much uproar about vaccines containing mercury, 10 years ago, the government mandated that thimerosal be taken out of vaccines. Since then, it has been noted that autism rates still rose after the thimerosal had been removed from the vaccines. This is why we know that thimerosal does not cause autism.